We hope you all had an amazing Easter holiday or a long weekend, if you celebrate it where you are currently. But also, I hope you had a restful Saturday and Sunday. Okay, just because we have always a limited time for these sessions, I know there are still people trickling in. Just to go through the start, welcome to the European Climate and Health Responders course, session 6. Sorry, session 9. I'm in the wrong week in my head. So that means you have one more after this one. We're almost at the end. We're excited that you've been staying with us since session 1. It's been 9 weeks of this. We're very excited for today's topic, which is on communication, engagement, and advocacy in climate change. So now that you've had the climate science, it's about how do we actually advocate this? How do we put this in moving forward? And so just highlighting here, session 9, you have one more session next week. And today's session learning objectives is really focusing on employing your effective communication skills with different stakeholders about climate health topics by defining your target audience, listening and developing audience appropriate messaging, to define the role of your role as a public health and a health professional in climate health activism and policy engagement, to communicate and share information and responsibility effectively at different organizational levels, to gain that political commitment, policy support, and social acceptance for climate action, and to also just understand how do you advocate for and learn how to implement these strategies to different stakeholders across an interdisciplinary and intersectoral projects on climate and health issues. And so, as usual, the logistics a bit for those who are joining us new today, or for those of you who have joined in the prior, it's a 90-minute session. We have a lecture and a case study. We also have a Q&A answer section. So if you have questions, please put them in the Q&A, not the chat. We are monitoring the Q&A. Sessions are all recorded and they're posted on the website within 24 hours. And you can also access reference material, slide decks on the website as well. We all know that we love having a certificate. We want to award you for coming out to all of our sessions. So for those who have attended over 70% of the live sessions and you pass the final exam with a score of 70% at the end of the course, you will be awarded a certificate of participation in climate and health from ASPHER and the Global Consortium Climate Change and Health Education. So the exam is going to be sent out on the final day of class via email. So pay attention to your emails. The exam link is also going to start on April 9th at 6 p.m. We know it's CEST right now, so it's actually 6 p.m. CEST, and it will close on April 11 at 6 p.m. CEST. The format of the final exam is going to consist of a combination of multiple choice and true and false questions. And so this is all information that you can go back and look at from the previous slide decks. You'll find it there. And also participants should be prepared to take the exam in one sitting. So what that means is make sure that if you're taking the exam, you open the link and then you continue through it before closing it, because that might not save your answers as well. So today we are very, very excited. We have some great speakers lined up for you. We know that on the website we have 2 case studies, but unfortunately one of our case study presenters is ill today. So we're very excited for Andrea, Grieco, and Professor Sue Atkinson to be sharing their work today. So to start off with the lecture, just to introduce Mr. Andrea Grieco, he is an impact manager, a stakeholder engagement manager in climate change and human rights communicator from Italy. So he has also been named as a discloser of the 2030 Agenda, a European Climate Pact ambassador for the European Commission. He's a top voice environment and for LinkedIn Italy, and an ethical influencer and the voice of the ocean for UNESCO. So to take it off, Mr. Andrea, feel free to share your screen. And we're excited to hear from your lecture today.
Thank you so much. Thank you to all for joining today. And I just share my screen. Can you see my screen? Yeah.
Yes, you're good.
Okay, just one moment. Okay, so nice to meet you to all. I'm very, very happy to be there for this very important moment to understand about the European climate, the situation about European climate change, and the situation to create awareness and to create a movement of stakeholder that they've very that know about the climate change situation and then know about the activism around the world. I'm Andrea Grieco. I'm an advocacy campaigner and a communicator, and I'm focusing in particular on the effect of climate change from a human rights perspective, and also climate refugees and civil activism. I contribute. I'm a global youth leader for G7, to contribute also to create a new policy proposal to be presented to the G7 presidencies. This year, the G7 will be in Italy, and the Italy have the presidencies of the G7. And I worked with the European Commission for the to spread the message of the European Climate Pact around the world and around Europe. The European Climate Pact was launched by the European Commission, and is a movement of people around the world who want to help European Union to be more sustainable and to create a new policies, to create a new to create a new dialogue around the world and around the climate change in Europe, starting from Europe. So just okay. No. Okay, just a moment. No, can you see my, okay. I don't know why. Okay, so
Yes.
First of all, climate change communication. Today, I will start by talking more generally in first part of my intervention about the climate change communication, how the information, it's very important, scientific information, it's very important to create awareness and to engage the stakeholder. And in the second part of the presentation, we're talking about engagement. We're talking about two different types of engagement. The civil engagement, and so also called activism engagement, and institutional engagement. So talking a lot about COP, the Conference of Party, the meeting, the annual meeting created by the United Nations for climate change to create a policy proposal in international field about climate change and about sustainability and human rights. In climate change communication is very important. It's a starting point to know the situation where we live today, because it's about education and it's about informing people about the situation, the bad situation that live around the world, and also to help people to understand the possibility to solve climate crisis and to put it in action, and also to create a massive people of activism around the world. Climate change communication basically start from different experience. For cultural experience, for cultural model. For example, I came from the south of Italy, but I moved to study for studying reason in the north of Italy. I lived in the north of Italy, and after I moved to go to work around the world, to go to France, to Ecuador, to Latin America in general, to Africa. So my cultural model, my experience is an experience of a migrants, economic migrants, in my work and in my experience day by day. So my communication start from my country. My communication starts from my people, from my family, and also from my mental experience and mental models. When I was young, I starting when I was I living in the south of Italy in a very little region called Basilicata, and in Basilicata we talk a lot about climate change. We talk a lot about the effects of the over production and production of oil and gas in my region, in my little region in the south of Italy. So that situation influenced me a lot, and for my because I was very, very lucky for my family, I create a mental models about the situation, the natural situation, and the connection between human people and the connection with nature and with the environmental situation. The way we talk about climate change affects the way people understand and think about the climate change and think about the solution to the problem. A lot of communication about climate change is about the risk and the possibility negative scenarios, but wrong about how we try to accomplish the global, the critical global of not just raising public concern, but moving people to action. That's because it appeals to reason, and reason is not what drive human capacities. It is a challenge that we must overcome in finding effective and efficient way to not only communicate the science as evidence of anthropogenic climate change, but mobilize public support for action and also for solution. So let's see the data, and the data tell us a very, very concrete situation. Stories about climate change are going to come from conversation that we have with the family, with friends, with colleagues, in work, in the university. And we need to all become multipliers of this message. In this true image, we have a data, a very clear data worked by Yale University, and we see in European Union the different situation about the people who heard about global warming in media, in the in the short time, and the people that believe global warming is happening now. In the second case, we have a lot of people that think the global warming is happening now, but the next step of the situation is that people don't know how to do to stop the climate change, to fight the climate change. And also people are not very conscious about the role of the single people, of the community, and the role of the activism to fight the climate change. In order to do so, we need to think deeply about these issues and understand how it will affect us. So we need to think critically about what kind of story we are telling. And we are telling stories of despair, and stories that will be inevitably. Are we telling stories about negative emissions, feedback loops, tipping points, and other things most people don't want to understand at all? This is the question. Or are we telling a story of hope, of possibility, of a human movement and human power? More importantly, are we making it clear when we talk about this that there are choices that we can make, which will determine what kind of future we want to go to have and to live in the life. So in this situation, the role of the stakeholder engagement, it's very important. The role of the stakeholders, it's important. When we talk about stakeholders, we talk about the people, we talk about the university students, the students of high school musical, we talk about the politics, the institution, we talk about the family. So we talk about the people who worked in a business and that. So everything from the psychological understanding of how we received data as information, they have the goal to inspire people to action. And the best work in the communication about climate change, it's to help people to understand the data, and next to help people to move to actions and to amplify the message, and to amplify a correct message in media and content, also in social media. I'm a influencer, a content creator on social media, and every day people writing to me to know about the climate change, to know about the Italy situation, about environmental situation, about the Agenda 2030, and the situation is the same. Politics don't talk about clearly about the climate change. Science is very clear about the effect, the human effect on the nature, on planet, but politics don't listen the advice, the science's advice, and also people don't know how to do. People, for the people now, it's not possible to move to action because people don't have the instruments. So it's very important, and it's very important to explain to the people their role, and also to help people to amplify this message. Creating engagement content, for example, basing on carbon pricing and the climate crisis, is a way to reach and influence decision makers, and mobilize people and move people to the action. Why? Because we start to talk to people. We can. It's important today to return to reach to the city, to return to the communities. And after when we start talking about climate change to the communities, to the small communities, and in the second step, it's important to share to spread this message to the political community, to the institution, to the local institution, and after national institution and international institution. For that reason, the stakeholder engagement, the political and institutional engagement of the stakeholder, it's very important. Today, the summit, the climate summit around the world are not really democratic because people go to the COP, the Conference of Parties, for example, or to summit on biodiversity, on human health, but going to this summit, going to the scientific world, to the experts, but civil people don't know. Democratic society stay out the COP, for example. So it's very important to reintroduce the civil society in the political and institutional process, and in including the civil society in this process, we make a very clearly politics and a very clear message to the institution. We have a lot of challenges in climate communication because today it's very difficult to talk about climate change because we have a lot of people that we have a lot of people that said the climate change doesn't exist, and we have a lot of challenges in climate communication and also in the communication of science about climate change and sustainability for many reasons. The first of these is the spatial and temporal dissonance, because there is a temporal and spatial dissonance when it comes to how we talk about the climate change and how people think about the situation. For example, we tend to think about climate change is a situation of the future. It's a situation of the Africa country, the Latin America, not for example, not a situation, a European situation, but the situation changed now, and it's important to start to think the climate change is a global issues. The climate change affects all people around the world, and also, for example, the climate migration. We have a lot of people that moving to their home in around the world. Every day we have a lot more or less we have 14 people moving for their homes due to climate change and climate crisis, and that people are not recognized by the international law, for example, because international law in the convention about climate migration don't recognize the climate change like a motivation to migrate. So people that's type of refugees are not protected by international law, and now still migrate around the world. Also in Italy, we have a lot of people that don't have more work and job in south of Italy for the new climate condition, and they move in the north of Italy to look a new job and to look a new life. So change tend to be abstract and physiologically distant, devoid of specific geographic, social, and temporal details, and typically do not feature to people. And if we know better, we still refuse to thoroughly internalize the fact and let it alter the situation about the climate change. It hasn't really helped that we have largely focused on sharing images and stories from very far away. And for a long time, climate communication talk also about polar regions, especially polar bears. We all remember the picture, the polar bears very, very sad, without food. This picture ended up creating a collective understanding of climate change, but a situation, a photograph of a picture of climate change very remote, remote from humans. So this situation is the first difficult, and the role of civil society and also the communicator and the scientist is to move to the also the animals and to go also to the human people, to spread the message and to help people to go to the action. Some research have placed high value on the importance of individual emotion and emotional response to the climate message and emotional response to the climate crisis. So the focus on Burr, for example, as a charismatic embodiment of the impacts of climate change, but it's very, very limited. We have a big limits to understand the climate impacts in the city we lived, and also in the city in the Arctic. When we think about the climate change in the Arctic, in the polar regions, in the Arctic regions, the first image that came in our head is it's the polar bear. But also we talk a lot of the people the indigenous people, the Sami people, for example, that lived in the polar regions and that don't have food, don't have nothing due to climate change. So the issues of climate change has been highly focused on single issues messaging, specifically around wildlife in the Arctic regions, that has resulted in the alienation of people from both the problem and the solution. For instance, in the communication, for example, of renewable energy transition, as well as environmental degradation of species arms, the disclosure has largely left humans out of the equation and out of the main problem, and the human are part of the solution with action, with sustainable action, with new change of life. But the communication about the renewable energy transition don't talk about the importance of human to make this change. The second challenge in climate communication is the languages. The languages are today still a very problem in climate change communication. The terminology, for example, used by scientists and advocates in communicating the climate crisis has contributed in the time to the public confusion of the issues. Naming the issues itself has been a challenge, for example. The terms of climate change and global warming have both been used for a long time to refer the atmospheric and climate disruption created by increased the carbon dioxide and other tipping point gases in the atmosphere. However, neither of these terms is particularly effective in keeping the public engaged with the issues, and naming the issues itself has been a challenge. The term why? Because for example, this is partly due to the fact that or another in the another way to repeat in the term when we talk about climate change and global warming, we don't figure the human responsibility in the situation. So language is in this way incredible, imprecise, and is something we usually do not tend to think too much about. And for example, our the terms in particularly effective in keeping in the public engagement engaged with the issues. There is also a problem of fatigue and over exposure to the topic about climate change and climate crisis. Also are we have heard both of these terms, so climate change and global warming, but today a lot of people don't know the difference about the two expressions. Another challenge come to language in communicating climate change, to communication scientific findings with public. Think about some of the terms you see on a daily basis in the formal language of climate scientists speaking to one another, conducting interview or writing reports. For example, theory, aerosol, bias, negative emission, positive feedback, positive trend, etc. All of these terms mean something totally different when we use this term in a colloquial way, on when we use this term communicating climate change. So the situation to explain the difference is very problematic, and also in the time contribute to create a public confusion around issues. For example, theory. Okay, for example, theory, talking about theory, the term theory, taking this word as an example, when used in a scientific term, theory is used to refer to something that is widely accepted as a true. For instance, gravity is a theory. And yet, when used outside of a scientific context, theory seems like a much weaker term for something that is speculative or not necessarily proven science. This is why it is a problem when scientists refer to the theory of climate change. They are not saying it is speculation or one of many different views on the issues, but that it's how it can be perceived or spun to the public. The other challenge in climate communication is the perception of climate action. We have both into dichotomized idea that climate action is about the choice, but we have a cognitive bias, which are what how our brains have been socialized to believe, even if not rooted in a reason, play a big role in making us buy into this idea. For example, the disclosure around reducing carbon emission has been framed in a way that sacrificed economic growth to the historical association there is between emission and economic growth since the Industrial Revolution. We are likely to assume this is casual, and if we reduce one, we also giving up the other. But this is not the case at all. Another example is the idea that in order to move away from fossil fuels and as an energy source, we must risk become energy insecure, or depends, or that climate action is simply too costly, and there is no real political ambition to make it happen. So that's all seems logical at first, and they are ideas that have been fed to us, but they are actually very far from the truth. From many years, the focus on communicating climate change and scientific findings was simply that, to convert the scientific evidence, for example, the effect of carbon in the atmosphere, in a communication. But we have a gap, because the language of the scientific language is not very simple, and it's not very accessible to civil society and policy makers, and the result is a very dissonance between the larger problem and the tangible action people can take to address them. A frequent concern from researchers is how communication strategies can generate action from change or dampen opportunity for it. Framing can be a big part of this challenge. Importantly, it results in the most alarmist response to the climate crisis and a backlash of opposition from those who understood these issues to be a vessel of massive negative change to our way of life. This double situation, double point of view of climate action has actually been used by negationism, and to ground their arguments against any type of climate action, since it is equated with losing something we value, our economic well-being, or energy security, for example. The other challenge the last challenge in climate for the climate communication is the informational deficit model. Because like I said before, we need to move people to action. So we need to inform people and to explain the real situation about climate change, the real situation, the real effect the climate change in their lives. This assumption has been studied and is known as the knowledge of information. We know that we have a knowledge of information or information deficit model. We have fallen into the trap of believing that simply communicating the science is a need to move people to action. But in communicating the immensity of climate change and the need for action, we have gotten to lose in the data. the fear and the need to tell people how bad things are. The information deficit model is problematic in many ways, while it may seems obviously, and it can actually backfire. First of all, the approach is based on the idea that information and understanding are necessary and or sufficient condition to political engagement, to move a political engagement. It also assumes that people need to be aware of all the facts in order to make sound decision, but in their daily lives, in their voting action, in communication. So we have this situation. We prove that data doesn't inspire in a better of the situation, in a lot of situation, and we need to reconnect the people to the data. We need to reconnect to the people to the real data of the climate change. There is evidence that this model can also backfire in the sense that it's turned people off to those communicators who may be perceived as condescending, and people don't want to be think about ignorant or irrational. This model so create a storytelling that civil society are not very are don't know a lot about the climate change and the climate crisis, and the civil society for the civil society it's impossible to fight climate change. This needed to shift from the affirming that ignorance about the details of climate change is what prevents greater concern and action. And in other words, it's not just about what we know. For that reason, it's important, and this is the second part of the my speech, to go to the action, to move the people, to help people to go to the action. We have the knowledge, we have the data, we start from the data, and we go to the action. Go to the action means go to create a group of people that know about the situation, that know about the solution, and they spread the message about the solution. We defined two types of engagement: a civil engagement and institutional engagement. The civil engagement is the engagement created by for people and for common people like me, like us, and for experts. In the civil engagement, people have a power, and people have a power to change the society and to change the political issues. In the civil engagement situation, people have a lot of instruments to help politics to control the pollution created by private sector, and to go to in a situation to the climate justice, to create a framework of climate justice. In the institutional engagement, clearly, we talk about the engagement of the states, of countries, of the United Nations system, of the European Commission system, the European Climate Pact, the G7 situation. The civil engagement is called more simply activism, and I wanted to talk to you a case study to a case study about the little country, little region in the south of Italy, the Basilicata. Was my region of origin, and Basilicata is a European hub for the oil extraction. And in my work in Basilicata, I simulated over time poor extraction practices. We have a lot of interest in Basilicata. We have a lot of interest about the oil extraction, and we have a lot of interest to don't talk about the situation, the bad situation and the bad health situation in Basilicata. Talking about, for example, the number of people who death for the pollution in Basilicata, that's lived in Basilicata. For years, local people have complained about environmental contamination and human illness, and faced with inaccessibility or absence, clearly, of official information, we start a civic monitoring activities in Basilicata. And I follow these ordinary people in their fight for environmental information. I follow these people in to help in the action when we find I don't know, a pollution in a country, a pollution in a soil, agriculture soil, and etc. and etc. I work crossing lands affected by the oil extraction in Basilicata. The Basilicata is called by Texas of Italy, and we have a lot of contamination and also disinformation about the situation. Also in Italy, Italian people don't know about the situation in Italy, in Basilicata, and also don't know about the new type of activism, the civil activism, the civil sentinel of the environmental activism and civil engagement. The communities can find in civic monitoring answers to the transformation of the terror daily experienced. For example, I took this photo in Basilicata, very close to the house of my family, and the effects of climate change are visible in the daily life in these vulnerable people. Also, the sentinel are remaining their features and now and have the know about the international situation and the information about social environmental issues around the world. The journey in Basilicata led to a creation of interactive maps that served as a platform for storytelling. Maps are very important, especially for mapping a local sentinel in the territories, and can be effective tools to understand the complexity of the contaminated spaces and the position of the contamination in the soil. Also, the maps are an important instrument to create a research geographically and experientially in the experientially level, in spatial extensions that can be embraced from above. By stressing how sensor technologies may enhance the sentinel actions, the role of twin transition come to the fore, building bridge between climate justice, environmental justice, digital rights, and community, a community who know who know about the pollution and the situation around the world. The contribution of different form of knowledge, data, and information coming from the sentinels, and also we have a emotional story with people, because the civil sentinel, the activists are a very, very ordinary person that are exposed directly to the environmental pollution. We study the environmental impact, and we know about the environmental impact of the oil and gas emission, for example, on oil and gas exploitation of the soil, from the situation, the health situation about the people, by pulling together data that are geolocated. The sentinels transform local ones into a joint and lively map of resistance, open to anyone who share their concerns or is just curious. And this action is visible friction with the arguably closed approach that local institutions and companies enact in governing environmental matters on their communication fora and in holding demands from ordinary people. The Basilicata case illustrates how civic monitoring, also through maps created from below, can be a form of care, of expression, and also a resistance and a resilience in practice. The Basilicata case also illustrates that it's important to create a society of people where people are engaged, where people know about the situation, where people know about the natural disaster and know about the health situation of the planet. We have the second type of the engagement, and it's called the institutional engagement. The institutional engagement basically is the climate diplomacy. The Paris Agreement and the United Nations Framework Convention on the Climate Change provide a very important basis from government to cooperation on climate change. Impactful climate diplomacy can maximize climate action, cooperation, geopolitical issues, and climate diplomacy plays an important role in addressing the complex and the global issues of climate change. I was observer in COP26 in Glasgow. I was observer for the civil society and the NGO for the process, the diplomacy process, the climate diplomacy process. And it was a very, very good experience also because the COP26 of Glasgow, it was the last COP open to the civil society, really open to the civil society, and also open to the NGO and activism world. In the next, in the year after the COP26 in Glasgow, we had the COP27 in Egypt. For me, it was a very, very difficult, still difficult to talk about the situation of Egypt, the COP27, because I was nominated for the Italian states and external states Italian, like a negotiator, but for me it was not possible to go to Egypt for the human rights situation. because in my past life I worked like a lobbyist for Amnesty International, and from COP27 in Egypt to COP 29 of this year in Baku, Azerbaijan. I think the civil society are not welcomed to the COP, but we're still working to help ADOR and to create a new instrument of participation from the civil society and for the common people or for the activists. Climate diplomacy brings together government, international organization, NGO, and the stakeholder to work towards common goals and find solutions to shared challenges. So through diplomatic efforts, country seeks to build a consensus, forge a partnership, and mobilize resources to tackle climate change on a global scale. This includes negotiating targets, facilitating technologies, and providing financial assistance to vulnerable nation. For example, talking about the loss and damage fund, a fund created by the COP 28, the last year COP, to help people that have a big responsibility for climate change to pay justice, a correct justice, a climate justice for the countries that don't have a responsibility to for the effect the climate change. In the last vision, effective climate diplomacy is a very essential for achieving the collective action needed to address the existential threat of climate change and the safeguard to the future of our planet. Why it's very important, the climate diplomacy of the COP? Because the COP, the Conference of Parties, are annual events. For in 2 weeks, the all states parties of the United Nations talks about climate change, talk about climate action, and talk about sustainability and human rights in the climate way, in the climate world. One of the most important role of the climate change of the COP is to facilitate negotiation, to adopt and the adoption of legally behind international treaties, such as the Kyoto Protocol and the Paris Agreement. And this agreement established the commitments and targets for reducing greenhouse gas emissions, promoting climate resilience, and supporting vulnerability communities. COPs provide a real platform for countries to showcase their climate initiatives, share best practices, and mobilize support for climate-related projects and initiatives. And also in the COP situation, countries make dialogues, make cooperation and collective action to create a new policies external to the COP. COPs plays a very important role in shaping the global response to climate change, also to advancing climate resilience future, and also and also to help people to understand so to help the not the people but the parties, so the states, the United Nations states, countries, to create a new format, a new policy format to fight climate change. For example, in the past years, we had a lot of external cooperation policies draft. For example, I'm thinking about the new policy documents created 2 years ago by Ecuador, Colombia, Peru, and Barbados, to create the most big area, ocean area protected around the world near their countries. And the situation is today that this area come to the reality next year. So it's important to create new partnership between states. And also think the COP like a big meeting with the boss in a work way. And for 2 weeks, people have countries have a goal to go out to COP with a document, an action plan to fight climate change and to help more the more vulnerable countries around the world. So the situation is 2 weeks talking about climate change, 2 weeks talking about climate crisis and human rights violation and related to the climate change. And every country make a new partnership with other country. The process of the COP is very, very hard to understand. We start with a plenary session.
Andrea, we're gonna have to wrap it up in 1 minute.
1 minute?
Yeah. Thank you.
Okay, so sorry. So we have a very long process, and we start with a big session, a plenary session, and after we go to the negotiation between states, and after we go to the final plenary session to approve the policy document. So climate diplomacy is, to a great extent, is a preventive diplomacy, because the climate diplomacy want to prevent the bad effects of climate change, and want to create a situation and a solution to fight the climate change, and also to engage institutions relating the issues to the climate change. So
thank you so much, Ms. Andrea Grieco. We really appreciate this lecture, and I think it sets us up really well for introducing our case study. So I'm going to pass it on to Marie. So Marie, if you want to take it away.
Sorry?
Yes.
Okay.
Thank you, Andrea. So I'm Marie. I'm a young professional with the Association of School of Public Health in the European region, ASPHER. I also work at the European Hospital and Healthcare Federation, and I'm gonna introduce Dr. Sue Atkinson. Thank you for being here, Sue. So she is a senior public health physician and senior executive and non-executive in the NHS, in local governments, and in national and international bodies. She has a lot of experience in influencing policy in local, regional, and national and international settings. She also had several key positions and achievements in her career, including the awarding of a Commander of the British Empire for services to health in 2002. Congratulations. She's also the founder of FAST, the Public Health Action Support Team, which is a non-profit community interest company delivering public health consultancy and training. And last but not least, in the introduction for today, she is also the chair of the Global Climate Health Alliance, the international alliance supporting and coordinating the health voice on climate change and health. I will now let you the floor. Thank you very much.
Thank you. Thank you very much, and thank you for inviting me. Thank you, Andrea, for a very interesting presentation. So my main real role in today's is about me being the chair of the Global Climate Health Alliance, and that's what I'm going to talk about today. This week is in fact the World Health Workers Week. And it seems appropriate, therefore, to talk about how the health voice can be more active in climate change and how the Global Climate Health Alliance tries to make that happen. We've been up and running for about the last 10 to 15 years, and certainly we'll pick up some of the things that Andrea has talked about. So next slide, please. What I'm going to talk about is really what is the Climate and Health Alliance, Global Climate Health Alliance, and what we do. And I'm going to pick up two examples, one around the COP and UNFCCC processes Andrea has just been talking about, and one about nationally determined contributions. And this is to show how we can utilize the health voice from these sort of examples. We also do other things in the Global Climate Health Alliance, but those are examples today. And finally, just to pick up generally about communicating and using your health voice. Now, I know all of you will not be formal health workers within health services, but you are clearly interested in the importance of health and the climate change, or you wouldn't be on this set of webinars. Next slide, please. So the Global Climate Health Alliance is about mobilizing the health community for climate action, health, and equity, including justice. Next slide, please. We have 180 member organizations covering 42 different countries, and we have 20 plus international members that reach both lots of different sorts of healthcare workers. So, for example, doctors, nurses, others who are interested in that. We include the global health, the Healthcare Without Harm. We include the International Council of Nurses. We include the IFMSA, which is the International Federation of Medical Schools Association, and many other and several other international organizations. We have a network of members that covers 46 million health workers globally, if you count all the people who are in all of the organizations. So we're a diverse network of trusted health professionals. Our networks are united by a shared vision of equitable, sustainable future, both to minimize the health impacts of climate change, but also to maximize the co-benefits. And what I mean by the co-benefits are the added value that you can bring to people's health by taking action on climate change. So, for example, these include things like active travel, encouraging people to walk and cycle and use public transport rather than cars, which both reduces emissions, but also will encourage people to take activity, which actually is good for their health. Similarly, in food, in housing, etc., there are co-benefits of climate action. Next slide, please. So, climate crisis is a health emergency. Andrea's told us about the climate crisis and many of the challenges in communicating about it, but it is a health emergency. It's the greatest global health threat in the 21st century. That was from the Lancet Countdown. And health impacts are happening now. They're not something just in the future, and they will actually get worse. And climate action, as I've said, can benefit health through the co-benefits. benefits are greater if the health and equity explicitly is embedded in a sort of health in all policies, which many of you will have heard about, is the greatest win-win. So our aim is to actually get health as part and parcel of the climate discourse. And I'll show a little bit about how we do that. Getting health improved is also cost saving from things like cleaner air, healthy sustainable diets, and active transport, as I've already mentioned. Next slide. So what does GCHA do? It empowers, trains, and connects health organizations and their members to be trusted messengers in their communities. Those health voices influence both public opinion, and that in its turn gives decision makers a mandate to take further climate action, as well as to directly influence policy. So Global Climate Health Alliance acts at all levels: international, national, regional, and locally. We've heard a wonderful example from Andrea this morning about local activation from local activists. And we will engage with some of those members around the globe, but we will also engage with different groups that work at a country and at a regional level, as well as internationally. So I'm going to use the two examples of some of the work we use. There's both international at the COP. Andrea's just been outlining a little bit about that. And Global Climate Health Alliance tries to coordinate the health advocacy that happens at COP. And I'm also going to pick up on NDCs, which are nationally determined contributions, which each country has to deliver at a local level to say what its climate action is going to be. And we've done an analysis of those NDCs around the world to show how much health is embodied in each of those. And then people can use that nationally to both influence policy, but also for local people to be able to use it as appropriate. I'll come back to that one. So some of the national work is also coordinated regionally, engaging with members, networks, evidence, sharing, collaboration, and coordination. And the Latin America and Caribbean is an example of that regional work that we're supporting and encouraging. And then locally, as we've already seen. Next slide, please. So Andrea has neatly already outlined for us the UNFCCC process that culminates in the COP. And I won't go into that in any more detail, only to say that the Paris Agreement in 2015 was the one which respect, promote, and consider their respective obligations on the right to health was the first time that health managed to get a word, not almost only one, but several words actually on health into the negotiations that are the annual negotiations that that Andrea has outlined for us. So in terms of what GCHA does in relation to the COP is, first of all, we've actually understood quite a complicated process, which we've been developing our knowledge about over the years. And it's not just the COP annual event. There's a process that runs up to it. There's meetings in Bonn, and also some of the main events that happen during the annual cycle of meetings, such as the G7 that Andrea mentioned at the beginning, and the G20 that happens each year, are all important landmarks in actually trying to get some of the climate change action and health into that climate change action. So unfortunately, Andrea indicated that the UNFCCC isn't the most effective, but it is actually the only international mechanism we have at present to actually have any international agreement globally on action on climate change. So that's the one that we need to use. So in terms of health at COP. Next slide, please. GCHA coordinates the work of the health civil society attending at COP. And at the last COP at UEA, COP27, COP28, sorry, COP28, there were 1,900 health civil society observers there. That's not very many, although it's a lot more than in previous years. Gradually, the numbers have gone up for health observers. But of course, at that UEA COP also, there were over 2,400 fossil fuel observers. So we're up against it in terms of lobbying. So there's a process whereby GCHA works to coordinate both prior to the COP. So, for example, we normally coordinate a narrative that's accepted, a collective health narrative between all of the health partners. And we also coordinate often some sort of health letter. This year it went to, or last year, it went to the UEA president. As yet, we haven't sorted out what will happen in this year of 2024. But the letter went to the president, first of all, calling for a phase out of fossil fuels as a health imperative, taking fossil fuel interests out of the talks. That, of course, did not happen. And it was signed by health leaders that represented 46 million health professionals. So it's a powerful voice from health leaders to actually say there is really important health issues happening because of climate change, and we need to do something about it. And there is a positive aspect to this because we can also benefit people's health and reduce the cost to health services if we actually make those that take those actions to address climate change and health. For this COP28 in the UEA, there was a health day for the first time. There was also an interministerial meeting on climate and health, which 49 ministers and many other senior officials from ministries attended. And 143 countries signed up to the COP UEA Declaration on Climate and Health. But that was missing in some respects, and particularly missing in relation to the more the issues around co-benefits. $1 billion was announced for climate and health, but actually that is a tiny sum in comparison to what is needed. So next slide, please. So these were the health benefits that came out of the negotiations at COP28. I won't go through these in huge detail. There was operationalization of loss and damage. There was a global goal on adaptation was adopted, which included language about the health sector, but not on the broader aspects of health. There's also positive aspects about transitioning away from fossil fuel, but certainly not the wording of phasing out fossil fuel. And there's lots of big loopholes in all of those things, which I haven't, that's the subject of a whole different talk, really. And there will be, of course, further work for the health voices to do at COP29, albeit that's in Azerbaijan, which is another oil state, and at COP30 in Brazil, which we're hoping again to achieve more health-centered climate action. So the role is to actually coordinate and get the health voice to talk with one or several simple messages to the policy people at an international level through the mechanism of UN, FCCC, to take that forward. I haven't gone into all of the detail. There are daily meetings for the COP health attenders. There are mechanisms whereby they can follow what's happening in the negotiations and try to bring health into those. They spend their time talking to both health, to journalists and also to the various negotiators that are attending for each country at COP. Next slide, please. So my second example of what Global Climate Health Alliance does is to actually do research and analyze. And we're talking here about the nationally determined contributions. So this is a document that each country has to develop and has to provide about the climate action plan to cut emissions and adapt to climate impacts. It was an agreement made at the Paris Agreement signed off in 2016, and NDCs have to be revised every 5 years. The next time NDCs will be revised is 2025, which will be the ones for the Brazil COP30. So we're hopeful that we can encourage more health input into those nationally determined contributions by that time. So the Global Climate Health Alliance, as I say, has undertaken various pieces of analysis on the NDC scorecard so that it's developed a scorecard both for health. It developed the first one in 2021, and it developed another last year in 2023, and also a specific scorecard on clean air in 2023. So it's looking at these health issues, it's looking at what can be improved in the nationally determined contributions, which are the action plans from each country. So the scorecard scores 5 categories, and those are outlined at the base of that slide. This is the one for health impacts, air pollutants, sources, sectors, and economics and finance. And then there are bonus points for comparing air pollution with mortality data. Next slide, please. So this is the ranking table that's produced. And I know you won't see this in detail, but it's just to give you an idea of what that's about. And each of the differently shaded purple indications are the different scores of those things I've just talked about, the air pollution, the health impacts, the economics, etc. And interestingly, Colombia and Mali were in the top with 14 of the top 15 scorers were also from lower middle income countries. Many of the big countries were actually down towards the bottom, which actually starts to demonstrate that they don't take air pollution very seriously, and certainly have not recognized the importance of the relationship between climate change and air pollution. A big part of that will either be direct emissions or will be from using fossil fuel, for example, in car driving and so on. So this is an example of how this can is analyzed by the Global Climate Health Alliance, shared with all of our members. You can actually access it on the website. I'll give you that link later. And then countries can use it at a local level, and health advocates can use it at a local level to try to get health and air pollution more recognized, and the health impacts of climate change more recognized in the nationally determined contributions action plans. Next slide, please. So key communication and advocacy messages include that climate change is an emergency, but it's also a health emergency. It's bad for your health. Urgent action is needed. But it's also a huge opportunity to promote health and well-being through the health co-benefits of climate action. I've mentioned those already. And there's many resources available on the co-benefits if you want to look up much more about those. I don't know whether you've heard about them previously in some of the previous lectures. Communicating the health risks of climate change is important, making people realize that there are actually health risks as well as environmental risks. But it's also very important to communicate the health benefits and to make the communication positive. And I think Andrea has emphasized that point in his talk previously. But it's also important to give people the message that whilst it's urgent to take action, it also can be fixed, and it can be fixed by climate action. And you need to be very specific about what those actions might be. And they will, of course, differ whether you're talking to civil society or whether you're talking to policymakers, because they can take different action. Next slide, please. On the 22nd of February last week, WHO launched a communication toolkit. It's called Communicating on Climate Change and Health, Toolkit for Health Professionals. Again, as I've said already, it is aimed at health professionals, but it recognizes that many people are health advocates who may not consider themselves as health workers or health professionals. I really, really suggest you take a look at that, because it does take you through step by step how best to communicate on climate change and health. And then I said I would give to you the GCHA links for the healthy NDC scorecard, so you can each look up your own individual countries and start to use that. There's both the healthy NDC scorecard, which are general issues on health in relation to climate change, and the clean air NDC scorecard, and those links are there for you. And then that's the general link on the website of the Global Climate Health Alliance, on which you can see much more detail about all of these issues and the other research we've done on all sorts of things. You can see resources, you can see all that we do, all of our members. You can sign up for a GCHA newsletter, and if you are part of an organization that's relevant, then obviously you can apply to join as a member. Next slide, please. So this, I'm not going to go through at all in detail, but please take a look at it. It's a piece of work that we did as the Faculty of Public Health in the UK. The Advocacy group did it, so thanks to particularly Emma and Anna on that one. And it's 3 sets of top tips from 3 speakers at a conference webinar we had about what's important about climate change and health messaging to external audiences. Certainly worth taking a look at those important messages about storytelling, leading on a personal angle, etc., etc. As I say, I'm not going to go through all of it, but do take a look at it in more detail. Next step, please. Next slide, please. The power of the health voice. There are 60 million healthcare workers or related, and we are the most trusted professionals in most societies. There's been lots of evidence on that as to who is trusted. Health workers come out professionals, health professionals come out much higher than many others, often top of the list. Journalists are further down, and businesses are usually way, way further down. We're also, of course, as health voices, motivated and driven by the ethical duty of care. We're champions for shared human values, people's health and the health of their family. That relates to what Andrea was saying about make it something that's very important to those individual people. But we're guided by scientific evidence, and that's where I've shown you how the science can actually inform what you can talk to people about. But bringing human stories in are really important. And many of us who do work in health care may actually have seen the impacts of climate change. For example, last year, 2022, I think, over 70,000 people might have been affected as premature excess deaths in Europe due to the due to severe heat. And those are some of the health workers down at the bottom. Next slide, please. No, that's not mine. There we go. This is just to say that health voices, if they come from doctors, nurses, healthcare workers, often get often get good publicity when they do make noises. Doctors warn climate change, threatens public health, etc. Next slide, please. Next slide. So key take-home messages: climate emergency is a health emergency, but it's also a huge opportunity to improve the health of people through co-benefits as well as through the action on climate directly. Use your stories, think about what's your climate and health message. Is it mainly about flooding? Is it about heat? Is it about infectious diseases? What is it? What can you say? Have your elevator pitch ready. I hope you all know what your elevator pitch is. It's basically if you got stopped, if you had the opportunity of going up in the elevator with a very important person on climate change, what would you say to them about health? So a 30-second to 2-minute statement about the importance of health in relation to climate change. Listen to and know your audience. Obviously, you will give different messages to different audiences. Be bold, use the science, but translate it and take it further, as we've demonstrated you can do with things like the NDC. Be positive. The vision of what the future can be is the thing, and the vision of what people can do to make a difference is important. Don't accept that it's not your business. Many of the climate activists will try to say it's nothing to do with health, or what are you talking about, or you don't know about it because you're not in the environment world. That's not the case. It is your business because health is a real risk in climate action or lack of climate action. Lead by example, go away and make a difference. Thank you. Next slide.
Thank you so much, Dr. Sue Atkinson. That was an amazing way to end our session. So I know that it is past the time. So for those who do have to leave, we understand. And we also know that there's been a change in the time zone. So for those who came a bit later, next week's session is an hour earlier because in the European region, they had a time daylight savings. But just before we wrap up, I'm hoping we can at least get a question in for each of our presenters. And I think Dr. Sue and also Andrea, if you want to turn on your camera, you know, there's so many great questions that came in the chat, and I wish we had time to go through all of them. But I think one question that would be great, I know you summarized it, but what can what's one action that health professionals just can take away today very simply? Because not everybody has that space to be an organization who's working directly towards climate action. So what's one thing that they can take away, and how do we, what can you give that for a suggestion?
Shall I go first? I think the first thing to take away is think about what you do, either at work or yourself or socially or whatever, and what impact does the climate have on some of the health aspects of that. That may be just something you've seen. It may be, obviously, if you're a healthcare worker, you may see patients with seeing the effect of heat stress or something like that. Think about one thing that's very real to you, and just think about how do you put that very simply in a 2-minute statement or a 2-minute comment, and use that as an example. So it's your story, it's your reality of what the health impact of climate change is, and try to use that in relation to things that happen in your work or in your social life or whatever, that might actually get the message across to a wide variety of people. And then gradually you can expand that because you can think of other ideas and so on.
Thank you. Andrea?
Yeah, for me, saying thank you so much for your presentation also. And just thinking about your role in the world and catalyze the energy in the direction, the correct direction. So for thinking about the how much it's important your work to help people and to our planet to survive, so to fight climate change and also find the solution.
I think those are great words to end our session with, and we will have that breath document of all your questions and share it with our speakers. If you are interested, able to reply to any of them, we'll be happy to kind of post that on the website as well. So I also just wanted to flag that in the chat, you will see a link to the questions for the feedback survey. That's really important to fill out. Just give me 1 second. Many slides open. But also there is something from the Association Schools of Public Health, ASPHER in the European region. One thing that we emphasize is not all of us have to be an expert in climate action, but what we're doing together is, raising this issue together. And I think Andrea has given us really great tools, and Sue's this GCHA has so many great resources that you can take to your organization today. And so we really hope that ties in together everything that we've been working on. I hope I can share my screen to be able to share you the QR code. And so thank you all for joining us today. We know that the session, there's so many great things to be able to talk about: communication, engagement, and advocacy in climate action. And we are really excited that next week will be our last session. So for those of you who are not in the European region, you might need to check your calendar. Hopefully the link will be updated, and we'll send a reminder as well. But because of the daylight savings, we kind of got in a weird fickle with that. We know that some of you joined late, but do not worry. The session is recorded. It will be online. And so please make sure you take the time to fill out the post-session survey. Thank you to Dr. Sue Atkinson, Mr. Andrea Grieco for your wonderful presentations today. And thank you also to my co-moderator, Marina. And so with that, we will close the session. Thank you all.